This is Metabolic Radio, the podcast dedicated to keeping you informed when it comes to everything fitness. My name is Taylor Empey, and with the help of my co-host Shane Pace, we aim to expose the truths about the health and fitness industry. The information and suggestions given in this podcast should not be considered as clinical or medical advice. Consult with a physician before implementing any information provided on this podcast. Now it's time for This Week in Health and Fitness. What's new and what's trending? All right, welcome to another episode of This Week in Health and Fitness. When this episode airs, it's going to be Tuesday, May 31st, due to the Memorial Day weekend. I just wanted to say happy belated Memorial Day to you. Hope you guys had a fun, healthy weekend, but we know that probably didn't happen for some of you due to all the parties and barbecues and family events that are always going on. So anyway, it's a chance for us to start things off right this week with focusing on fitness again. So first things first, recent news, the FDA actually issued a final food defense regulation that just came out, and it's the FDA's Food Safety Modernization Act. Basically, this aim is to help prevent wide-scale public health harm by requiring companies in the United States and abroad to take steps to prevent intentional adulteration of the food supply. So they're enacting these rules where the actual companies, domestic and foreign food facilities, are basically required to complete and maintain a written food defense plan that assesses their potential vulnerabilities to deliberate contamination, where the intent is to cause wide-scale public health harm. So it almost kind of sounds like a anti-bioterrorism kind of thing, but it's oriented around our food supply. And actually, when you think about it, I haven't actually talked too much about all the recent contaminations because they're actually so many and so hard to keep up with. I did announce a couple in an episode a few weeks back, but I'm getting emails from the FDA on a weekly, sometimes daily basis of different food recalls that are taking place due to contaminations. And those are just kind of things that are accidentally happening. In this act, it sounds like it's more directed towards intentional contamination of foods for whatever reason that would be taking place. That's why I kind of alluded to the fact that maybe it's just more of a protection of our food supply from, bioterrorism type acts. But, there's just all these slew of food contaminations that are going on all the time on a weekly basis that people don't even know about unless their local grocer is informed about it. And so I could see how that would easily be something that could take place. So it's kind of good that an act like this is being put together. I think that a lot more safety measures probably need to take place with quality control of the food. Yeah, so that's pretty much that. Moving on to the next thing, I found a really cool tool actually this week. It's basically a tool that is a map of where all of the USDA certified foods come from in the United States. So what you can do is you can go to blogs.usda.gov and search for "Know Where Your Food Comes From" with USDA foods, and it'll pull up an article they posted about where all the various USDA certified foods come from around the U.S. I don't know. I just think it's a fun tool to have, and I think it's cool that we can kind of see, okay, where does our food come from? Because it could come from all the way around the world, or it could come from our own country. It could come from multiple states away. How long does it take to get here? What does that do to the quality of the food? That kind of thing. And it's just an interesting kind of thing to note and know where you're getting your food from. One of the bigger things I wanted to talk about today was something that was in the Mayo Clinic. In an article in the Mayo Clinic recently, doctors declared that dietary and behavioral intention methods being used to help obese adolescent kids get back into shape is just not quite enough, apparently. They're recommending bariatric surgery. So, now, for all of you who don't know what bariatric surgery is, which many of you probably do, it's a technique that uses a few different approaches, but the most common is where they take a band and surgically wrap it around part of your digestive system, forcing a person to be restricted on how much they can consume in kind of a last-dash effort to keep them from over-consuming and getting them to lose weight so that it can keep them in an energy deficit, and hopefully their body starts mobilizing body fat for fuel. But, I mean, I just hardly feel like this is a viable, healthy, or long-term solution, especially with adolescent kids. I mean, think about it. What's the root cause? What they addressed before, which was behavioral problems and just basically associations with food, especially education. That's one thing that Shane and I always stress is education. We need to focus not on treating symptoms of problems. We need to focus on treating sources of problems. And that's one thing that, I wish we could get more effort put into, and I know there is, and I'm not a super political person myself, so I know that in some areas I'm not entirely informed, but when it comes to policy, and I know this is something that's easier said than done, but we really need to be focusing on educating our community, educating our children, focusing on effective behavioral strategies and education, so that these people can not get to this point where they're severely or morbidly obese, but in their teen years. That's problems that are in the food industry and these other things that we've talked about that need to be addressed. Bariatric surgery, in my opinion, is just not, like I said, a healthy, viable, or long-term solution. And I think that there's just going to be a slew of more and more problems that develop as a result of this later on, as we're not really treating the real root of the problem. And kind of think about it like this: what are we teaching our kids? We're teaching them that they can just do whatever they want and they can snap their fingers and everything will be okay because they have a quick fix to their problem. But that reinforces the quick fix mentality. It focuses on treating symptoms and not the source of the issue. In my opinion, more research and funding and effort needs to be put towards those proper focuses and not necessarily focused on surgeries like this. Now, is there definitely a place for them? Absolutely. If it can save somebody's life, we definitely need to use that as that last-ditch effort. We need to keep things like this in surgeries and certain medications and things like that to help with acute problems like that. But when it's a chronic condition that can be controlled from something much earlier in a person's life, I think that we should look at some alternative options. Our future depends on these people. These are our children. This is the next generation. And right now, if you look at the statistics, our kids are going to outlive us. We're going to outlive our children. So what that means is they're less healthy than we are, and we should be getting more healthy as a society as a whole. So that's my thought on that. In other news, a few years ago, the CDC analyzed some data from a 2013 behavioral risk factor surveillance system, which is basically a system of telephone surveys that gathers health-related information from residents all across the United States. And the data included about 400,000 adults aged 21 and older. And the team looked at what proportion of these individuals actually adhered to 5 health behaviors that were known to reduce the risk of death from chronic disease. These risk factors were not smoking, exercising regularly, avoiding alcohol consumption and only drinking in moderation, maintaining a healthy body weight, and getting a sufficient amount of sleep. Surprisingly enough, or sometimes it's not surprising, but only 6.3% of adults engaged in all 5 of these health behaviors. 6.3% of those 400,000 people. The results of the study did not really, have very good news, obviously. It revealed that only 1.4% of the adults failed to engage in any of the 5 health behaviors, which seems like a small percentage to not engage in any of them. And some of the numbers are favorable as we move up the ladder a little bit. A total of 8.4% of the adults engaged in one of the health behaviors, 24.3% engaged in 2, 35.4% engaged in 3, and 24.3% engaged in 4. So it's good to know that at least a fourth of these people are engaging in at least 4 out of 5 of those healthy behaviors. So that kind of makes it a little bit better, letting us know that we are at least trying to be healthy. We're not maybe engaging in all of abstaining or engaging in the right activities and abstaining from the wrong activities, but at least a quarter of us are doing the majority of them. This is what I want to get across is that Shane and I, this is why we're doing the podcast. We're doing this to help educate people. We're doing this to give out free information. We're sacrificing our bits of time so that we can help people out there like you, whoever's listening right now, to help educate you in proper ways to exercise, proper ways to eat, proper ways to, address supplementation, get rest, live just a fulfilling, good life that's oriented around health and wellness, if that's what you want for yourself. And I think that we're fighting a losing battle. These numbers kind of, with the childhood obesity, with how few people are actually engaging in all these proper health activities, it's just it's a major issue, and we're fighting a losing battle as obesity and type 2 diabetes and other chronic conditions are just continuing to spike and elevate, and we're not meeting our healthy guidelines that the government and qualified individuals in the industry are trying to help us reach. We're actually, we're doing the opposite. We're running away from those goals in terms of what the statistics are showing us. So we just want to ask you to help us win this battle. Help us spread the word of fitness. Get out there and talk to people. Share this podcast, share articles, add people to our Facebook group. You can do that by going to Metabolic Radio Private Forum on Facebook. Add yourself to the group. We'll get you in there, and then you can start adding people to the group yourself. And that way we can start touching as many lives as possible. And that's what this whole effort is oriented around, is just helping people through health and fitness and getting the education out there, since it isn't out there entirely yet in certain forms that Shane and I feel that it should be. So, as it goes, that's pretty much what I have for today. And if you guys want me to cover something in the next episode of This Week in Health and Fitness, or just want me and Shane to cover a topic on the podcast, or you want a specific question answered, then just let us know. You can email me, Taylor@metabolicradio.com. You can email Shane at metabolicradio.com. Or you can go to our Facebook group and ask your question there, or go to metabolicradio.com and click on the Q&A tab and submit your question. And we'd be happy to get back to you. So until next time, go spread the good word of fitness. Talk to you soon. Hey everybody, thank you so much for tuning in to today's episode. Shane and I hope you learned something new and exciting today about your own health and fitness. Head over to metabolicradio.com. There you'll find our bios and our results-driven programs that are designed to help teach you everything you need to know when it comes to getting real permanent results. You can also sign up for our newsletter to get free weekly updates. To chat with Shane or I, just email us at taylor@metabolicradio.com or shane@metabolicradio.com. We would love to hear from you. You can also join the conversation on Facebook. Just go to facebook.com and search for Metabolic Radio Private Forum. There you can request to join the group. We would love to add you to the conversation and answer your questions on the show. And hey, if you like our podcast, please help us grow our community by leaving us a 5-star rating and review on iTunes. We would really appreciate your help. Thanks again so much for all your support and your listenership. Now go out there and spread the good word of fitness.